Good afternoon from Ghent in Belgium, and welcome to the EFA Patients Digital Prize award ceremony. We are the European Federation of Allergy and Airways Disease Patient Associations, EFA, and we represent more than 200 million people living with allergy, asthma, and chronic obstructive pulmonary disease, COPD, across Europe. In an era of digital revolution and a sudden acceleration towards general digitalization, especially in healthcare, EFA launched the Digital Information Technology Project, or as we call it, the DIGIT project, with the aim of putting patient voice from the COPD and asthma community at the heart of the impact, opportunities, and challenges of the digital revolution in healthcare. The DIGIT report, published last year, surveyed 970 asthma and COPD patients in 5 European countries and offers evidence of how technologies are used today by patients and the factors that are shaping their future adoption. The DIGIT survey finds that user-friendly digital health tools are welcomed by patients of all ages and all social background, provided that such tools address their needs and they are given the time and training required to use them. As representative of the European asthma and COPD community, we wanted to take stock of the ongoing developments, and we wanted to celebrate and recognize those who in the digital health sector center asthma and COPD patients' needs from development to implementation. And that is the reason why we launched the EFA Patients Digital Prize. From the findings of the DIGIT report, we developed evaluation criteria to assess asthma and COPD digital solutions that put patients at the center through their design, accessibility, and efficacy. We opened the call for submission in January in 2023, and we received submission from so many European digital innovators that are putting forward technologies that break down barriers, promise security, and look beyond controlling asthma and COPD and towards improving quality of life for patients. We thank you all for your efforts and commitment to develop solutions for our patient community. A prestigious jury formed of EFA representatives, healthcare professionals, young patients, digital health industry experts, and EFA sustainable partners looked at the pillars for a successful tool and how the innovators introduced the approaches of co-creation and digital partnership between patients, healthcare professionals, and solution developers. We want to warmly thank all the jury members that did an amazing and thorough evaluation of the many applications that we received. I'm honored now to leave the floor now to two of our honorable jury members. They are not only patient advocates and EFA members, but also digital experts. Armando Ruiz from FENAER, Spain, and Anne-Elisabeth Eriksrud of the Norwegian Allergy and Asthma Federation. Armando.
Thank you, Valeria. Good afternoon, everybody. Welcome, everybody that is joining us in streaming. That's very nice. I'm really honored to present together with my colleague, Anne-Elisabeth, the winners of the first edition of the EFA Patients Digital Prize Award. Digital health can help the healthcare system to be personalized, faster, more efficient, and patient-centered. This is a big opportunity, but as you know, we have also many challenges. This award is very important for us. We want to recognize the work of the people who lead the best solution for asthma and COPD, but also because patients' organizations must demonstrate our role as stakeholders, and this award is the way of adding value to the ecosystem. We have to work together with industries and startups. One of the main challenges of health technologies is access. And for this, we have to bring our expertise to identify real unmet needs of patients, design products that is giving real value proposition and improve the adoption and implementation of the evidence-based digital health solutions. The jury has evaluated these 6 criteria: accessibility, partnership with healthcare professionals, convenience, support and security, prevention, and equity. Thank you to the jury, and thank you so much to all the participants. The show must go on.
The first category of the EFA Patients Digital Prize is the category covering digital technologies and solutions for asthma care. The winner in this category stood out specifically for the engagement with patients in the process of developing of the digital technology for the purpose of creating an app that responds to the needs of asthma patients and that is affordable with the costs borne by the healthcare system rather than the user, the patient. The winner of the prize for the best digital technology for asthma is Asthma Tuner from MediTuner AB. Asthma Tuner is a digital medical device used in Sweden, Norway, Denmark, and the United States of America, used as a self-management device for patients with asthma. The app allows patients to have instant and objective instructions on how to adjust medication based on the variability of the disease. Congratulations to the winner. On behalf of Asthma Tuner, we have Johanna Edoff, who is heading the implementation of Asthma Tuner, present today to accept the prize.
Thank you, and thank you for the introduction, Anna-Elisabeth. Dear members of the European Federation of Allergy and Airways Diseases Patients Associations, I am here today representing the whole Asthma Tuner team, and we are thrilled and so thankful to accept this award for Best Digital Technology for Asthma. It's a huge honor to be recognized by an organization as EFA that is dedicated to improving the lives of people with respiratory diseases. And we want to thank you not only for this award, but also for your ongoing commitment and work with these patients. Asthma Tuner was created with the goal to empower people with asthma to take control of their health and to live better lives. It provides them with knowledge about their condition and is designed to ensure that treatment is based on the most recent guidelines, regardless of where they live or receive care. And we believe that technology and innovation closely linked to research has the power to transform healthcare. And our main focus has always been to develop solutions that stem from the patient's needs and gives valuable information back to the patient. And that's what we see is unique with Asthma Tuner, and why we are so proud today to accept this award and look forward to continuing our work, both for patients with asthma, but also to continue to improve other solutions for other respiratory diseases. I would also like to take this moment to extend our deepest gratitude to all the patients and healthcare professionals who use Asthma Tuner. Your feedback and support have been invaluable in helping us to improve the product and also better serve the needs of the asthma community. So thank you again for this honor. We are so excited to see what the future holds. Thank you.
Now, the second category is COPD. We had very high quality submissions, and the winner shows more clear accessibility and considerations for security and support. The winner of the prize for the best digital technology for COPD is RespiraSense. RespiraSense is a motion-tolerant and continuous respiratory rate monitor from PMD Solutions. RespiraSense monitor chest and abdomen movements to measure respiratory rate consistently and accurately. Unfortunately, we don't have a representative from RespiraSense in the room here in Ghent due to conflicting agenda. But Miles Murray, the founder and CEO of the company, sent us a pre-recorded video to accept the prize. Congratulations to the winner.
Hi, I'm Miles Murray, founder and CEO of PMD and inventor of RespiraSense. It's an honour to be recognised for the EFA's Patient Digital Prize for COPD. The work we conducted during 2022 has been transformational, which has been built upon a decade of realising our vision of making every breath count. Across 12 weeks of monitoring severe GOLD or GOLD COPD patients whose hospitalisations were once a month, we collectively avoided 100% of hospitalisations and empowered patients to gain back their independence. By working in partnership with payers, providers and patients, we've been able to co-create a managed service that empowers patients to be a key partner in the management of their condition, while equally empowering clinicians with the early warning of exasperation, all the while removing the technology burden from the healthcare system. RespiraSense is a revolution in respiratory rate monitoring, with the world's only motion-tolerant design, given highly reliable and personalised respiratory trends so that the right care can be triggered at the right time. Monitoring over 40,000 patients a year across 25 healthcare facilities. And to share in our appreciation of this recognition, I'd like to introduce you to Des O'Toole, HSE Clinical Lead for Digital Transformation and Respiratory Advanced Nurse Practitioner Antoinette Doherty of Letterkenny University Hospital.
Hi, my name is Des O'Toole and I'm the Clinical Lead in Digital Innovation at the Health Service Executive in Ireland. Delighted to share with you our experience of using RespiraSense in our community virtual ward, Letterkenny, Donegal in the northwest of Ireland. We adopted a design thinking approach to learn, build and test. And for us, it was all about creativity. Creativity is the development of ideas. Design is the connection between creativity and ideas, and innovation is turning ideas into value. Design thinking is turning ideas into value around the needs of the users or the needs of our patients. And design is too important to be left to the designers, and that's where we need to engage with all our clinicians and all our service users.
Hello, my name is Antoinette Doherty. I'm an advanced nurse practitioner in respiratory care in County Donegal. I partnered with HSE Digital Transformation and PMD in my pursuit for an alternative care pathway for individuals living with COPD in the community in quite a rural setting in Donegal in Ireland. The objective was to support the patients to remain well at home using technology. Respiratory rate was a unique clinical observation that I wanted to include into the project, so this is why we selected PMD. With the respiratory trend, we were able to identify exacerbations earlier. The patients were able to work within the confines of the project, which included a rescue script within the home, which meant they had quicker access to therapy, in turn reduced the incidence of infection, the level of infection, and for the duration of the project our patients remained well, and these are patients who were previously high exacerbators and high health cases. For the duration of the project they remained well in the community.
Once again, on behalf of all the stakeholders of this award, thank you so much and good night.
And the last category is for solutions for both asthma and COPD. The EFA Patients Digital Prize would also like to acknowledge the numerous digital technologies that respond to the needs for both patients with asthma as well as patients with COPD. This was the category with the most submissions in the edition of this edition of the prize, and the winner is providing a digital solution available across multiple countries with translations in different languages that works in the disease management to improve the quality of life.
And the winner of the prize for the best digital technology for both asthma and COPD is Nuvoair Home from Nuvoair. Nuvoair Home is a dual interface platform designed to enable data sharing the remote monitoring for health for people with long-term respiratory conditions. This allows clinicians to make faster decisions about their patients' conditions while also helping patients to understand better their lung health. We do not have a representative of Nuvoair here in the room in Ghent due to conflicting schedules. However, Helen Parrott, Director of Clinical Operations and Evidence, kindly sent a pre-recorded video to accept the prize. Congratulations to the winner.
Hello everyone, my name is Helen Parrott and I'm Director of Clinical Operations at Nuvoair. I'm sorry that I can't be with you in person today, but on behalf of everybody at Nuvoair, we would like you to know just how excited and proud we are to have been awarded the EFA Patients Digital Prize for the best digital technology for people with asthma and COPD. So Nuvoair Home is a platform designed to enable remote monitoring and management of the health of people with long-term respiratory conditions. Patients receive a home monitoring technology pack, which includes a spirometer and an inhaler sensor, and they follow their data in our app on their smartphone. At the same time, their clinicians can view and act on this data in a web-based portal. And this shared data view supports clinicians to make better and faster decisions about their patients, while at the same time empowering the person with COPD or asthma to better understand and manage their own health. But our solution does not stop there. Using our learnings from people with lived experience of respiratory conditions, we have been able to evolve our solution to be more than just technology. We provide a service too. Our team of digital coaches onboard patients to the technology, supporting them throughout and coaching them to get great quality data from the home environment. Patients also receive air quality data in their app. They can set reminders to take medications or to measure certain aspects of their health, and they can make comments so that their clinicians can see how they feel and how their symptoms are doing. So in summary, Nuvoair supports the patient in partnership as they move through the healthcare system, speeding up decisions and providing high quality lung health and adherence insights that are truly patient-centric. Our service and technology would not be where it is today without the input of people with lived experience of respiratory conditions. So to be recognised at this European level as empowering people with COPD and asthma is something we are very, very proud of. And it drives us to continue to improve the healthcare experience for cardiopulmonary patients. Thank you so much to the EFA and to the patient judging panel for this amazing recognition. We are really, really proud. Thank you.
We thank everyone for their participation in this EFA Patients Digital Prize, especially those who submitted their digital technologies, as well as to our prestigious jury members who took the time and offered their expertise in selecting the best solutions of this edition of the prize. We would also like to thank EFA sustainable partners who have been supporting this project with unrestricted grants, Chiesi and Roche. Lastly, we want to thank everyone who joined our online broadcast and those who are here with us in Ghent, in Belgium today. We hope that this is only the beginning to recognize and acknowledge the efforts of digital health developers in creating digital health solutions in partnership with patients and healthcare professionals in order to improve health outcomes. Thank you very much and have a nice evening.